and like sing it into the microphone.
I'll do that. Yeah, I always wake up and
Yeah. All right, so
Oh,
where we are, so you guys are going to have a quiz. So we were going to do it Friday, but since there's state testing on Friday, we're going to push it back to Monday. So we'll have a quiz on all of reproduction on Monday. We'll probably be finished just about completely with our notes today, I would guess. So we'll go from there. So we've already talked about male and female, all the reproductive organs. You're going to have to know the function. You're going to have to be able to label the diagrams. Now, the diagrams that we had in our notes, for the male, it was the side view. And in the female, we had both. But you should be able to recognize all the parts from either a front view or a side view. So in the male, again, we obviously have two testes. Just like in the female, there's two ovaries. There's two testes in the male, okay, a left and a right. You see that each have the vas deferens.
we have this.
Do you not have
we
this?
don't.
Oh, okay. So just look. So the vas deferens, which loops up into the body, then comes down. It merges here with the urethra. Along the way, the prostate gland and other glands add fluid to the sperm cells to form semen, and then that leaves the body through the urethra and through the penis. On the female side, again, two ovaries, a left and a right ovary, two fallopian tubes or oviducts that bring those eggs to the uterus. We have the uterus, the opening is the cervix, and then leaving the body is the vagina. So just sort of two different views of those parts. So what we need to talk about now is a little bit more about the development of the embryo and fetus and those sorts of things. So if we go back and think about where this all begins, it begins with fertilization. And that happens in the fallopian tube. Sperm are released by the male into the vagina, but then those sperm cells, in order to fertilize an egg, they have to make their way into the fallopian tube. And if there are sperm there around the time of ovulation, when an egg is released from the ovary, then that egg can be fertilized. And again, fertilization is a single sperm cell entering into that egg cell. After that egg cell is fertilized, what's the first thing we call it?
Embryo.
Before that even?
Zygote.
A zygote. So that single cell that has now 23 chromosomes that were being carried on the sperm cell. There's 23 chromosomes that were there in the egg cell. They combine to form 46 chromosomes. That's the normal number for a human. You all, in your body cells, you have 46 chromosomes. 23 of them came from your father, and 23 came from your mother. You always share exactly half your chromosomes with each parent. So, the egg is fertilized. It forms a zygote in the fallopian tube. It travels through the fallopian tube. Along the way, it's growing, it's dividing. It goes from that single zygote, and the cells split into two cells. And then those two cells each split into 4 cells and 8 cells. And it starts to form a little cluster of cells. After about a week or so, that little cluster of cells reaches the uterus. It moves through that fallopian tube and is now inside of the uterus. Also, we would call that the womb. And this embryo then attaches to the lining of the uterus. It embeds, or we say implants, into the lining. Remember, the lining of the uterus, it's been thickened because of hormones that control the menstrual cycle. Blood vessels are formed, getting ready for this, getting ready for an embryo to implant. Okay?
What happens if the fetus develops inside the fallopian tube?
It's a good question. So it's called an ectopic pregnancy. So sometimes the embryo gets stuck in one of the fallopian tubes. It doesn't make its way into the uterus. It actually starts to grow inside of the oviduct. And usually in that case, it can't grow and survive there, but it does, and so usually one has to have surgery to remove it, okay, because it can be dangerous to your health. If all goes well, that embryo travels into the uterus, where it's going to stay and develop for 40 weeks. It does not develop inside of what?
The stomach.
Inside of the stomach, right? Not a good place for the embryo. It's filled with hydrochloric acid, right? It's not where embryos are meant to grow. So
I have a story, but I'm not
where the embryo attaches to the wall of the uterus, it could be in different spots. It could be on the left, could be on the right, could be up high in the uterus, it might be down lower in the uterus, but it embeds somewhere. And then an organ called the placenta forms. And the placenta is very, very important, because the placenta is what allows for the embryo to get nutrients that it needs, to get oxygen, and also to get rid of waste that it's producing. This embryo and fetus is growing. It's using up lots of energy, but it also is producing waste products. It can't breathe. It can't eat. So it relies on the placenta to get the material it needs. Now, an important thing to know about the placenta, so the placenta forms on the wall of the uterus, and it's where blood vessels from the fetus are sort of located right nearby blood vessels from the mother. And so because they are right nearby, the capillaries allow oxygen that the mother has in her blood to diffuse into the blood of the fetus. And nutrients that the mother has in her blood can diffuse into the blood of the fetus. At the same time, waste products can go in the opposite direction. But blood from the mother doesn't actually go into the fetus itself. And blood from the fetus doesn't go into the mother. The blood vessels are not connected like this. They're just sort of right next to each other. So material can pass back and forth, but there's actually no mixing of their blood. The blood supplies of the fetus and the mother are kept separate. So the placenta is here. It's attached to the fetus through the umbilical cord. The umbilical cord has 2 arteries in it and a vein. And their job of those blood vessels is to bring blood out to the placenta and then bring it back. And when it goes back into the fetus, it can circulate throughout its body, supplying the nutrients and the oxygen that all the parts need. So?
You know how like after a baby's born they get like the umbilical cord cut off?
Yep.
And then don't they have that like kind of like stump thing there?
Oh yeah.
Yeah.
That's nasty.
After the baby is born, after the fetus is born, it's born, and it still has the umbilical cord attached. The umbilical cord is still attached inside the mother, goes into her uterus. It's still attached to the placenta. And soon after the baby is born, the placenta inside of her uterus detaches. And it comes out afterwards. So even after the baby's born, the placenta comes out afterwards. You know, and it looks like a big thing about this bag, and it's just, you can see all the blood vessels in it. When you see the umbilical cord, you can see the blood vessels, and the umbilical cord sort of curly. And that comes out afterwards. So the mother, just one quick story. A good friend of mine is a nurse, and he's been a nurse for a long time. He was a nurse. He started right after high school, basically, as he was still in school getting his nursing degree. And so when he was doing his OBGYN rotation, which is a doctor, obstetrician, gynecologist is a doctor that delivers babies and works with women's reproductive organs. So he was doing his rotation. As a nurse, you have to sort of go and observe different specialties. So he was in the OBGYN, so he was in the room when he saw the first birth ever. So he was in there, and a woman's giving birth, and he's sort of just observing. He was just kind of a student. And so she had the baby, and everyone was really happy. and obviously, and then the doctor told her, okay, keep pushing, and so he was really excited. So he said, oh my God, it's twins, but it wasn't really twins. What the doctor was telling her to keep pushing to get the rest of the placenta out, but he thought it was another baby, so he was kind of embarrassed having said that. But yeah, the mother continues to get contractions, and the placenta comes out afterwards. So.
Is this the doctor I know?
No, this was a friend of mine that's a nurse. So.
I know a lot of doctors.
Well, let me hold on to your question, and then I'll answer your question later. So the period it takes is called the gestational period. The amount of time that the baby, the embryo, the fetus is supposed to develop for, it's about 40 weeks in normal situation. What we say is that 40 weeks is about how long the embryo should be inside of the womb. You know, a lot of times you might hear people say 9 months. It's actually longer than 9 months. Really, doctors generally will use weeks to sort of tell the age of the embryo as it's growing. 40 weeks is typical. But between 38 and 42 is considered kind of normal full term. If it goes beyond 42 weeks, usually they will induce labor. They will give a woman medication that mimics hormones in her body that forces her to go into labor. Okay? If it's before 38 weeks, it's considered preterm labor, and it's too early. And depending on how early, they may do different things to try to hold off labor until she gets into the 38 weeks. It just depends. So we've been using these terms, embryo, fetus, and so forth. So so the first stage we know is the zygote, but that is only when it's a single cell. Once it divides into 2 cells, we start to call it an embryo. Up until about 8 weeks. 8 weeks is the point which after 8 weeks, we start to use the term fetus until birth, and then we call it Billy or whatever.
Billy?
Susan.
Billy?
Yeah, Billy.
Oh, you named the baby.
Oh,
Yeah.
I was like, wait.
I was supposed to be named Erica.
So when we look here, this is showing a fetus inside of the womb. We have the placenta attached to the umbilical cord, and then we obviously have the fetus. So this, if we look at a diagram of the fetus in the womb, this would be towards the end of development. And one of the things that tells us this is towards the end is the position of the fetus. Because
It turned around.
towards the end of development, the fetus will turn so it's head down. Doesn't always, but usually. So if we look here at this, what would you say? How are we going to label this top line? What are these?
Fallopians?
Fallopian
Flagellum.
Not a flagellum. Flagellum would be on a sperm cell.
You screwed up.
Never mind.
Or a euglena. But this is not a euglena, nor is it a sperm cell. So yeah, these are the fallopian tubes. These are also called the oviducts. This entire organ here,
The
raise your
uterus.
hand if you can tell me, how should we label that, Vinny? That's the uterus. Again, what we might call the womb sometimes, that's the uterus. It's very, it's a muscle, but it's very expandable and contractible, I guess, in that it goes from very small and compact till as the fetus grows, it expands much larger to hold the fetus as it develops. Here, attached to the wall of the uterus, we would have what? That's the placenta. It's attached to the umbilical cord. Oh yeah, and you guys asked earlier, so in humans, after the baby's born, generally somebody will cut the umbilical cord. Sometimes the father does it, sometimes the doctor or nurse will do it. No, there's no nerve endings in the umbilical cord. So like I cut all my daughter's umbilical cords. They'll give the father the scissors and they just cut it. It's kind of like rubbery. You can see the blood vessels going through there, but there's no...
You touched it?
No, but you can feel the cutting with the scissors. It doesn't have nerve endings, so it doesn't hurt. It just has blood vessels. So they cut it, And then what will happen is usually after a nurse will sort of weigh the baby, do a couple little tests, make sure it's healthy, and then they'll put a clamp on it so it doesn't bleed, so it's still connected to the circulatory system. And then very close to the baby's abdomen, they'll put like a string and tie it off. And that's where it's going to heal. So what's going to happen is after the point where they tie that little string thing around it, the part after, because it no longer has a blood flow, because that string's cutting off blood, it dies. And it turns bluish black. And
baby dies.
Eventually it falls off. That's the remains of their umbilical cord, and then what they're left with is just a normal navel, a normal belly button. And depending on how it heals, that determines if it's an innie or an outie or whatever. Big? That was a question?
I was gonna say, is that how you?
Yeah, it kind of depends on the organs beneath it and just how it heals and stuff like that. All right, so
In from there.
also inside of the uterus, the fetus is inside of another membrane.
Oh, jeez.
What's it called?
Amnia?
Yeah, the amniotic sac,
That's so good.
which is filled with a fluid called amniotic fluid. It helps to cushion and protect the fetus so that as the mother is moving around, the fetus isn't bumping around in there. It's in this nice little warm pool of water that keeps it safe.
So like water?
It's not water.
It's like liquid.
It's fluid, but it's
Is it
and actually since it's basically surrounded in this liquid the whole time it's developing. So its lungs have this fluid in it. And so why doesn't it drown?
Because it breathes out of
Because
the
it
placenta.
hasn't developed the thingies
Like the lungs.
Yeah, its lungs don't work.
Oh, yeah, they have-
They're not needed. So how's it getting oxygen to grow and live? Yeah, it's getting oxygen through the placenta, through the umbilical cord. It doesn't need to breathe. It also doesn't need to eat. Again, because it's getting the nutrients that it needs through the umbilical cord. It's getting glucose and proteins and fats through the umbilical cord, so it doesn't need to eat anything. Obviously, this is the fetus. And then the opening of the uterus is the cervix. So if we talk for a minute here about, all right, so if this is close to the time this baby's going to be born, what happens? Well, when a woman is far along in her pregnancy, she's getting close to full term, how does she know, what is one of the things that alerts her that she's going to be having the baby soon? Her water breaks. That's the term we sometimes use. So what is actually happening when a woman's water breaks?
Oh, does that mean that the amniotic fluid comes out?
Yeah, it means that this sac surrounding, this amniotic sac, it ruptures, it breaks at some point, and this fluid that's inside of it leaks out through the vagina. Now she isn't peeing, it's not urine, it's actually amniotic fluid. And this is one of the first signs that she's probably going to have the baby soon. In fact, the doctors will want the mother to have the baby within about 24 hours. Because once that amniotic sac breaks, the barrier between the outside world and the fetus is sort of broken. So it's possible bacteria can get in and infect the womb, can infect the fetus. So they want her to have the baby within about 24 hours of her water breaking. Now sometimes it doesn't, her water doesn't break and she goes into labor. Sometimes the doctor will just break her amniotic sac, just poke a little tool in there and it break it. Sometimes that speeds up, it speeds up her labor if it's happening slowly, because once that amniotic fluid is gone, the baby then puts more pressure on the cervix, which causes it to start to labor to progress. So her water breaks, and then what's the next thing that happens? Yeah, she eventually starts to get contractions. So contractions start off not painful, just sort of a tightening. So when we talk about contractions, remember, the uterus is a muscle. And like any muscle, it can contract, it can shorten or tighten. And so what happens is the uterus starts to contract. And at first it's not painful, it's just sort of tightening. it's only once every 15 minutes or so, but that's a sign to the woman that, okay, I'm having this baby pretty soon. As her labor, so we call that labor, as labor goes on, what happens to those contractions is they start to become more intense. They start to get closer together. So rather than having one every 15 minutes, it would be 12 minutes and 10 minutes and 8 minutes. And they get closer and closer together. They become more and more intense. And so once they're getting closer and they're more intense, usually the woman will go to the hospital. Some women have their babies at home, it depends. You could have a midwife, is not a doctor, but a person that specializes in childbirth. Some people give birth with a midwife there to sort of oversee things. Sometimes they have a midwife and a doctor. When a woman goes to the hospital, usually it's just nurses that are there, and the doctor comes in at the very last second to actually deliver the baby. So these contractions get stronger, get closer together. Okay? What's happening is each time the uterus is contracting and getting slightly smaller, and that's starting to move this fetus down towards the cervix. Also, the cervix, during the time the fetus is in the womb, it's closed, basically. It's sort of sealed up. And what happens is labor starts to open up the cervix and make it thinner. They call that dilating. If you ever heard about a woman giving birth, talk about how dilated. The doctor checks every once in a while, say, oh, you're 1 centimeter dilated, you're 5 centimeters dilated, 6, 7, up to 10. 10 is about fully dilated. And what that means is the cervix is opened up wide enough to 10 centimeters that the fetus can actually fit through and can start to be born. So these contractions are happening. The cervix is dilating. It's called effacing, getting thinner. It's getting ready to let this fetus out. And then it turns into, then we go from labor. That could take a while. It could take, hours and hours. It could take 12 hours or 18 hours. It depends on the individual. It might just take an hour. Then things sort of switch and we move into the delivery stage. And delivery is when the fetus starts to make its way through the cervix, and then the woman has to physically, so all this is sort of unconscious. A woman's not deciding to have a contraction. But when it switches to delivery, then a woman has the urge to push the fetus out. And so the fetus moves, usually head first, through the cervix, has to go through the pelvis. The bones of the pelvis are right around there. So the head comes, if the fetus fits best head first, then it goes through and then it sort of twists and the shoulders fit through. The shoulders are the widest part of the fetus, so that's usually the hardest part for the woman to deliver. And so it comes through head first, through the cervix, through the pelvis, and then through the vagina, okay, until the woman fully pushes the baby out, okay. Again, the umbilical cord is still connected there. The placenta is still inside the uterus. After the baby's born, the placenta detaches, the placenta and the umbilical cord come out, and then the baby's born. David?
Does the head have to come out first?
No, so if the baby's in the opposite position, like feet first or butt first sometimes, what do they call that?
Oh, reach.
Breech. It's in a breech position. Sometimes babies can be born vaginally in a breech position, but it's harder. The baby doesn't fit through the cervix and the pelvis as easily when it's coming feet first. And so sometimes a woman can give birth vaginally in the breech position, but sometimes if it's not progressing, they may have to do a C-section. We'll talk about that in a minute. Really?
Like when the person's giving birth, why doesn't the people, like the doctors and the nurse, come and pull the baby out?
Because it wouldn't be healthy because the position of the baby, it might not be the right position to just come out. It has to come through and has to twist. Also, the process of the woman pushing the baby out actually does some good things for the baby. Because it's being squeezed through a relatively small space, it forces a lot of the fluid that's in the baby's lungs, it forces a lot of it out so that when it's actually born, it can start to breathe pretty quickly. So that's another benefit of that. hold on. They sometimes do use tools to help. They sometimes have forceps that they use to help guide the baby out. They have suction device they could use, but they try not to use it because there's a possibility they could hurt the baby as it's being born. So as long as things are moving along, they usually just let the baby be born naturally. With the woman pushing it, however quickly it comes, it does. Okay.
Okay, so like when the baby's born, what happens to the stomach?
The stomach, like her abdomen, that was used to be large because there's a baby inside there and everything. So what happens is, so once the woman gives birth, first off, a lot of that fluid is gone. So when she was really big, what that was is her uterus was really big. Inside of her uterus, there was the amniotic sac filled with fluid, which was really big. So once she gives birth, that stuff's gone. So the amniotic sac's gone. Her uterus is still pretty big. And her skin has been all stretched out because it was holding that whole baby. And so it takes a while. What happens is, even after a woman gives birth, her uterus continues contracting. She could feel it. And that's shrinking her uterus back to a normal size. Eventually, her skin can shrink back down to a normal size as well. But it takes time. It's not like instantly, like you just look like you did before you're pregnant. You have sort of your skin is sort of droopy till it sort of regains
How
its
long
original
does it take?
weeks and weeks.
Isn't it like that?
It's not fat, but it's just skin. All right, we got some more to talk about, I guess, tomorrow.
Ew!
There's a fetus. There's the umbilical cord.
Is that real?
That's I don't know if it's real or if it's computer.
Hi,